Thank you for coming back. I hope nobody is getting bored or something. If you have any questions, you can ask me. I would like to thank you again for staying for the entire workshop. There's one particular doctor here that I saw. He is my personal teacher in the past, Dr. Shadi. Welcome, Dr. Shadi. He's a very, 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 very well-known injector. So I'm very humbled that he is here watching me now doing the trainings. Alrighty, so your name is?
Carolina.
Again, Carolina.
Yes.
So much Carolina is here. So Carolina is going to sit up, and again, I'm going to show you. It's not going to be like a holistic approach for this one, because Carolina has, you see, a retracted chin. We're fine on the screen. We're fine on the screen. Everybody can see. So Carolina has, as you can see, some retraction to her skin, to her chin. This is where I'm going to be focusing most of my work. She has, as discussed in the first patient, thick skin. She ages with gravity pull. So for us to do the lifting, we're going to need more modalities like threads or any kind of radiofrequency lasers. For her, I'm going to do a treatment for the under eyes with the eye booster. Those of you who were with me during the break, they had the feel of the under eye booster, which is very, very, very thin. So this is my ligament, and this is my area of injection, a very medial triangle where I'm going to inject my eye booster. See, this is the vector we are looking to lift. I can do just a bolus injection in the maximum area of projection. It will give her some little bit of lifting. But don't do more than this, otherwise she will have widening to her face. We can do a tiny bit for the marionette, but the most area that we're going to focus on is the chin, a little bit the lateral jawline. Which products under eye? Eye booster. Which product for a bolus to give a nice lift? L. And one piece of advice, when you use the L, use with it the 25 gauge needle. Otherwise, it's not going to go in. It's a thick product. I know it's a thick product, but it really gives a good result. Same thing also we can use for the marionette. And for the jawline, we're going to use, as usual, cannula with XL. Any questions or any suggestions? Okay, so let's start. Okay, sleep. Okay, so first we will start with the under eyes. So you have the eye booster? Yes. Okay, this is the entry point. Come here, please. So let's start with the entry point for the eye booster. I go deep to the level of the bone. Again, I take the track of the ligament because this will help me elevate the entire tissue. Just a tiny drop. 1, 2, 3, 4. And I'm done. That's it. So this is for the eye booster. Now when it comes to the direct injection with the L, as I said, the maximum point of lifting, direct injection, give the patient a bolus. And I want to show you the direct lifting that she got. Can you sit up, please? And when she sits up, you can see that I still have here volume loss and the deep fat. Relax. So we will inject that also with direct injection with Infini L. There you go. Sit up. Now you can see the difference between the two sides when it comes to the nasolabial folds. Little bit of lifting to the vector. One more area that I need to inject is the lateral cheeks. This is done. Why am I doing this? Why am I sitting the patient up and sitting her down? Because I don't want her to have volume. She has a round face. She has good amount of volume. She has already good fat in her face. We don't want her to have more fat or a rounder face. Remember, we need to achieve the heart shape. Now, if you sit up, please, there you go. Okay, so this is 1 ml of L and a tiny few drops of eye booster. You know my technique by now. I do injections with fillers and then I end up with meso because meso is going to hold everything into place. Next, we're going to do the jawline with cannula XL. Same technique. We have the jawline that is a little bit retracted. We're going to make it longer and more bulging. Can we remove the blood from that area? Can you stand there? 1, 2, and 3. So I'm injecting my XL. In the areas where the patient has lost her fat. So this is how she can get the perfect jawline. If you sit up, so you can see now the difference, right? No marionette line prominent here. Here it's more prominent, right? The jawline is more defined as compared to the other side. Here you have the nasolabial folds that are still prominent, and here it's all lifted, right? We can still add some in the deep fat, some L direct injection deep fat. Can I have L? Yes. Please. And we can add also XL in the marionette. Again, the same technique, same point of entry that I use for the lateral jawline. I will go and I fill up all this area before I do direct injection with L. L is very good for the injection of the chin. One, 2, and 3. There you go. Remember your anatomy. This is perfectly safe. And you're done. I usually use a 22 gauge cannula by 70 because it's long and I can use it everywhere. Direct injection.
Direct injection.
The orange one, this one. Please, direct injection. Okay. Usually the L is very useful using it for direct injections. Now comes the big one. She needs, of course, Botox because we have to relax the muscle. Relax. See, when she's tightening all the time. So you can start with fillers and then you can do Botox, not in the same session. We are going to try to make her chin longer and more protruded. I need more L. More L, direct injection. Direct injection. You know, I can do the cannula. It's fine.
Yeah, it's fine.
I need the point of entry. Entry point. So, again, 1, 2, and 3. We're going to fill up the entire area. And there you go. Turn your face to the side. So here we're going to be supporting more the marionette and pushing the chin forward. I put my finger, make sure my product doesn't go anywhere. She will feel some pressure, correct? I know that the other candidates we worked half face, but in this case we have to do everything because I want to show you how the chin is going to push. Sit up, please. Relax. Now you see the difference with a face that is lifted and the face that is still down. So the first candidate, she had a thick skin and she had good volume, but she had also loss of elasticity in her skin. The second patient has a very thin skin and she was a little bit skinny, so she had more loss of volume. Third patient has a round face, retracted chin. Most of the patients you see in the clinic, if they are young, then they don't need much treatments. This is where the job of the meso comes into play. We have mixed here aqua booster with amber with collagen. How old are you?
40.
40.
Today.
Today? Happy birthday to you. Happy birthday to you. Happy birthday to Carolyn. Happy birthday to you.
Thank you.
Blow the candle. Blow, blow, blow. Again, so let's do now the meso. So, you remember the first patient, we did for her the 5-point injections, then the superficial ones. The second one, we didn't do for her the 5-point injections because she will not benefit. She has a very thin skin. For her, she will benefit, okay? Because she has a thick skin and good volume. Again, 5 points, 1 centimeter underneath the lateral canthus, medial to the tragus, and the jawline, submental area, and lateral to the nasal bridge. So 1, 2, and 3. Watch now what's going to happen with my meso. I know it doesn't last, but I always keep telling doctors that they can use it for therapeutic reasons. So over time, patients will get good results. And blood, 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 blood. There you go. Give me the other one, please. You can see the effect of the meso. Okay, I need you to stand there. Turn your face to the side. And now, the final touches. Under eyes, lateral cheek, lower cheek, contouring of the cheek, contouring of the jawline. You remember the technique that I used for the other patient that had wrinkly skin? I don't use it here. Open, open, and she's done. I think that's it. Happy birthday. I just gave you a bruise on your birthday. There's your mirror.
Yeah.
You can have it.
Okay.
Okay. And how do you feel?
Wow.
Can I have you sit in, please? I'm going to let her sit up, and we're going to see right versus left. And after we're done, I'm going to continue your face. No, can you sleep back?
Okay.
Birthday girl. So, like I told you, I do a lot of threads in my practice, and it's very difficult to give a patient that has good volume the result of the threads without giving them a wider looking face. This product is good because combined with the meso, it helps me achieve that. Can you sit up? And we're done. Good? Nice, thank you. Merci. Next is, now we're going to have two older candidates, and I'll tell you what we can do with them. All right. Any questions? Yes?
How many milliliters in the mixing?
Usually, let's say Aqua Booster. Aqua Booster comes in 1 ml. It's a box that has 2 syringes, 1 ml, 1 ml. I use 1 ml for the patient. I put it in 3 ml syringe. Okay, so it's 1 ml Aqua Booster. Then I take 1.5 of any other 2 ingredients, 1.5 DNA and 1.5, for example, amber, 1.5 NHA, 1.5 collagen. So in total, I have 4 ml. 4 ml, as you saw, I used it where? I used it as 5 points, and then I used it superficially everywhere. 4 ml on each side, so that's 8 ml. The vial comes in 10 ml, yes, Paulina? The vial comes in 10 ml, so you take only 1.5. So imagine how many patients you're going to do. Now, here. So when a patient comes to you and they need sometimes more work, more than fillers, more than threads, more than maybe surgery, and if you want to give them a boost, the meso is perfect in this case. So what are we going to use here? Doris, correct? Are you Doris? Doris? Okay. Amber, under, okay, for Doris, I'm gonna use now the combination of under eye with amber, okay? So under eye at the level of the bone, which is the eye booster, and then the amber. This is for her eyes. For the smoker lines, I'm gonna use the S filler of Infini, and I'm gonna do it with a cannula. Okay, here we're gonna go superficial. Remember the arteries? For the lateral jawline, I will use the XL. When do I use the XL? When do I use the L? You saw the L is when you want to give really good definition, good volume. You just put the needle there and right away you have the lift and it holds. You cannot do it much in the jawline if the patient has already good volume. Okay, otherwise she will look wider. The XL, it's smoother. It will give lifting, but it is smoother. And for the full face, we're going to finish by mixing meso L, wait, NHA and DNA. So this is L,
DNA.
DNA,
Meso L.
and I need NHA. Here? No. Meso-L, NHA, and DNA. Maybe, what is this?
Here it is.
It's here. You have L, you have DNA. I need NHA. How much I'm going to withdraw from these? I would say, because, again, thick skin, good volume. What do you do? 2 techniques, 5 points, and then everywhere on the face. Okay? So since I'm going to do her full face now, we're going to do probably on each side 6 ml, 6 ml. So 2 ml of DNA, 2 ml of L, and 2 ml of NHA. 2, 2, 2. Okay? On each side. So I need 12 ml. So 2, 2, 2. Prepare them.
In 3 syringes.
You can, yeah.
Without
And 3,
mixing.
yeah.
Without mixing.
Mixing, yes, of
Mix
course.
with
Yes,
mixing.
yes, we'll always mix. Okay? 2, 2, 2. So, or you can withdraw 3, 3, 3. 1, 1, 1, 1, 1, 1, 1, 1, 1, 3 syringes. Okay, so you get the way you withdraw is with the 18 gauge needle. It's easier. This is the 18 gauge. Withdraw 1, 1, 1, 1, 1, 1. Okay. Meanwhile, like I said, I will start with the under eye booster. I always use a cannula for the under eye. Not sure what you do in your practice, but cannula is the safest approach. So, sit up please, Doris. So, like I said, so for Doris, we are going to be treating her under eyes. What's different in Doris that we didn't have in the other patients with regards to the under eye? Who can help me with this? Why should I be more careful with Doris compared to the other three patients that you saw? Why? In the under eye. She has what we call fistones. And these fistones, they come from what? Hormonal issues, smoking, water retention for any reason. We never inject these, okay? And this is the ligament that is pulling down. So I have to focus on injecting that one. Plus she has volume loss here. If I put for her fillers, she will have worsening of her under eye. We don't put fillers for Doris. So we're gonna do the eye booster here under eye. You can use the Infini S as well, okay? You can use the Infini S under eyes. It will give a nice result. This is a no-go zone for us. This is my area of injection.
Excuse me, I have to ask you. Actually, I don't know what is fistone. Do you mean malar area?
Yes, the collection, the triangular collection of the water retention. We call it fistones. What I do in my practice, I'm going to give you a trick. You're going to thank me for this later. You melt it down with hyalase. You can melt it, it goes away completely with hyalase. Sometimes it needs a couple of sessions. Sometimes it needs 2 sessions, but it goes away, okay? But don't put too much. Put like 0.2 or 0.3 maximum. Massage it, send the patient home, she comes back, there's nothing. Then you can do your injection, all right? Now, so this is my vector. Thick skin, good volume. She's a candidate for a little bit of fillers, not too much, but more thread lifting. So I need to lift this using fillers. Any suggestions? What would I use for this patient? We set threads. If I want to use for her fillers, I would use under eye booster or Infini S, which is the small filler. Then I would do for her some lifting. I would use the L, Infini L, direct injection. Direct injection.
Okay, so just change needle.
Yes, put here. What did you mix here?
Here is, wait a second,
What do you have here?
this and this.
I want all 3.
Yeah, I know.
Okay. So no need to mix because
But I have prepared one. already.
Where?
Here it is.
Okay, so can
so
you
it's
mix?
the second.
Yes. Second, and I need one more with 1/3. Okay. So we will start as usual with the under eyes. Would you like me to inject Infini S under eye? Do you want to see the results? Okay. Let's have the Infini S under eye. Because you've seen the eye booster already. All right, you can relax. Lay back, Doris.
Yes.
Sleep. And cannula. 1, 2, one more.
Can I make it in 5? Because I have already.
No. Withdraw 1, 1, 1.
Yeah, but can I make it in this syringe?
Yeah, no problem. Why? Because you don't
Oh, no.
have?
I will manage.
You don't
I'm
have to
just
open you.
stressed.
You don't have to open you. I know you're stressed. Relax. Deep breath. It's fun to be on stage. خلاص. By the way, I'm done. That's it. I'm done.
Yeah?
I'm
Okay.
done. Thank you. Give me. Which one is the third one? This one?
L.
L? Okay, that's it. And close this, please. And put yellow head. All right. Now, I need you to help me. Give me the S with a cannula. Ready? Ready? Okay. So I will start by doing for you injection under eye. 1, 2, and 3. This is my entry point. This is my S. Remove the entry point, please. Take this. Okay. 1, 2, and 3. Again, I'm deep. I go under eyes. You have to be very careful in her case. Just inject at the level of the bone. I always put my finger here so that the product doesn't migrate. I feel the cannula. I made a lot of videos with me being blindfolded. I like to do under eyes and brag about the fact that I can do it without looking. And we're done. That's it. Sit up. That's it. You like it? It's nice. So not only she had improvement of her under eyes, but she also had improvement in her fistones. She had improvement in her cheeks as well, right? Go back. This is nice. Now, I need to use for her direct injection L. Close this one and give me direct injection with L. What is direct injection L?
You took it already.
This is Infini L. This
Just bring
is,
it to you.
yeah, can you bring me L? I will put, don't, relax. I will put a tiny bit more of under IS. And one more trick. I'm injecting in front of the fistone, and I'm going to inject behind it. This is my fistone. I'm going to inject, on top of it, near to the bone. Again, I'm going to go back. S. We are still working with S. We are not working with the eye booster because you want to see the S. And there you go. Much nicer. Close this, please. Thank you. It's here. So I'll show you the eyes. Now, see this ligament? It's still prominent. I haven't injected that one. We're going to do direct injection. Go back, please. 1, 2, and 3. This is 0.2 ml. Again, 1, 2, 3. Another 0.2. the nice thing, the take-home message I want you to know is L, 25 gauge cannula, 25 gauge needle, direct injection, gives you instant lift, not given by any other filler, honestly.
Sorry, there will be no swelling in this area?
There will be no what, excuse me?
Swelling.
Swelling? Just minor swelling. Minor swelling. This is the maximum swelling that she has. And I continue my contour, direct injection. Even if the patient gets swelling. You know, I had this question asked a lot during the break. So your patients apparently, if they have swelling, they don't like it, right? Different countries, different approaches. So, sit up, please. You can see how the nasolabial fold is completely lifted, right? The other side is down. Again, I repeat myself, this is a difficult candidate to treat with fillers and to give her this result because she has a thick skin and good volume. Now, I can do a little bit in the jawline, but I'm not very much keen on that because it will not change much, okay? It will change very little, and I don't like to put fillers without needing those fillers. But I will do a little bit in the marionette. So I need direct injection, also L. Bravo. You're doing fantastic. So you're doing great. Yeah. 1, 2, and 3. So for us to get rid of the marionette, I would advise to do 3 procedures together, not in the same time. Let's say I started with fillers. Next time you tell her to come and you do some Botox, and then next time she comes, you do for her threads. 1, 2, 3. How do I know where I need to inject? So something was supporting the skin before, which is the fat, and the fat is gone. So this is where I inject. And I do not inject too much in the fold itself. Otherwise, it gets worse. And as you can see, we always inject the chin. I go very deep. It will help me, tighten the entire area. Can you sit up again? I'm so sorry. See, without touching the jawline, I gave her a jawline. Now, after I did the chin and the lateral chin, she might benefit from a tiny drop over here. This is the L. Yes. This is going to be your favorite product in the clinic, along with the amber and the eye booster. But as a filler, this product gives magnificent results. There you go. So this is the L. You see? You can tell how one side is lifted and one side is down. We finish off with our mixture, which is what? Infini Meso L, NHA, and DNA. Again, thick skin, good volume. What do? 2 techniques. Which one? 5 points and superficial. Sleep up, sleep up. All righty, 5 points. Do you want me to draw the 5 points again? I will draw them. Thank you. All righty, so this is 1, this is 2, this is 3, this is 4, and this is 5. Yeah. Actually, this is where you have the ligaments. So when you are injecting behind the ligament, you give the lift. That's the whole point. They coded 5 points for the purpose of marketing. 2, 3, 4, and 5. Now that I'm done with the 5-point injections, I'm going to finish off with the lifting technique. I always do from the lower cheek, okay? As if I'm drawing now, finishing my Mona Lisa. Lateral Lateral jawline and a tiny drop under eye because I have to. Okay. That's it. Fusidin ointment gel, please. Whenever you get a tiny bruise, you just press very hard, and I need the wipe with alcohol. You can press. And Fusidin, the cream. After we finish, I'm gonna do your face later, the other side, yeah? Now, do you think she needs treatments for the smoker lines? Not anymore, right? Everything is lifted. Can you sit up? And there you go. Face completely lifted, face completely down. Okay? So she can, what you can do for later, what you can do, you don't have to do all this, but at least you can start with the fillers. Then to make a big impression on the patient, do the mixture of the meso and then tell her that if you want to maintain with this treatment, come back and do 4 treatments within 3 weeks. And it really doesn't cost you much in the clinic, and you can sell her a package and she can use it over the course of 4 weeks. And repeat it then after 2 months or 3 months. Merci. Thank you.
Thank you so much.
My last candidate. Perfect. Now, you can remove the numbing cream, please.
To remove?
The cream. The cream and clean with them. Okay? So we will use the same combination, it's fine. We will use the same one. And then for her, can you please sit? Okay, come. No, stand up. Give me your hand. Come here. Come to me. Okay. And sit from the middle. Yes. So, full face 5 points, mix, nasolabial fold, aqua booster, amber DNA, lips M, only aqua booster. Anybody, 1 second. So, for the last patient, because we cannot do much with fillers, she needs more advanced treatments. I'm gonna show you the effect of the boosters by themselves, okay? 5 points, and then superficial, then I'm gonna do the smoker lines, then I'm gonna do the lips. Does anyone want to do their lips? Anybody wants to do their lips? Yeah? Okay. Can you come? Can I see you? Yeah? Because for the patient, you're not gonna see much difference. She has loss of volume. But like rejuvenation, so you already have fillers. You have? This is your lips?
Yeah.
MashaAllah. Wow. Where are you from? What's your name?
Portugal, Magna.
Magna. Okay, come to me, Magna. These are your natural lips. 0 fillers.
0 everything.
Really?
Yeah.
You want me to do your full face? Okay, we will start with the lips.
Yeah.
So, is the camera here? I need to show her lips, if possible. So for her lips, you know, I have something in my clinic that if a patient comes to me and she has old fillers that has migrated up or down, I don't do a single drop of fillers without melting down everything. I start from scratch. I don't care if I have to melt down 1, 2, 3, 4 times. She wants fillers the way I do it, which is very superficial. She has to melt down everything. Otherwise, 1 drop can ruin my work. So for smile, so we have, yes, some of the gingiva that is showing. So we're gonna do some fillers that are natural.
Okay.
And I'm going to change a little bit the shape of the lips so that this elevation goes down. So we're gonna flip the lips, okay? Lip flip, okay? Contour, this is painful. You need to get me the, yeah, can we put numbing cream for her? And you need to get me the lidocaine from my room. We're going to inject you with lidocaine. Is that okay? Because it's painful.
Yeah, don't worry.
It's in the fridge.
I did a C-section, so.
Okay. So a numbing cream for the lips. And the lidocaine is in the fridge.
Okay, okay.
This is, come, Paulina. You have to go to this room.
Okay.
And you open the fridge.
Okay.
You find the lidocaine. Alrighty. Hi. You understand English? No? No? Oh, you can translate?
Yes.
Okay. So your name is, what's your name? Danuta. So for Danuta, can you sit up, please? Sit up.
Usiąść. Usiądzie pani.
Okay. So I'm not going to do any fillers. I'm just going to do boosters. And you're going to see boosters for patients that have skin damage, how they're going to benefit. And you tell the patients to do multiple sessions. And I'm going to do a little bit of work around the lips and the smoker lines. Okay? So we're going to use the M for the lips. M. Merci. Direct injection, this one, please. So I will start with my mixture. Again, same story, thick skin, large amount of fat, 2 techniques, 5 points and entire face. 1, 2, first point. 2, 3, 4, and 5. 5 points. This is same mixture, same thing that we used before, which is the aqua, the DNA, and the amber. Okay? All right. Can you sit up, please? How do you sit? Okay. So we did the booster only. You will see the best result when she is going to do the smoker lines. Relax. Okay. This is what? M? Okay. This is going to be a little bit painful. So I'm going to use a cannula for her. And we are going to be using the collagen C+, which is an injection, to take care of the smoker lines. Thank you. And give me the entry point, please. All righty. Can you give it to me? So, open. Open. Yes, thank you. 1, 2, 3. Sorry. Strong woman. Okay. Now, with a cannula, I do my dissection first. All right. Then I'm going to fill up the entire area with collagen. Again. There you go. This is if the patient doesn't want to have any fillers. Okay? Now, I'm going to show you when I put the fillers what happens. Give me the medium. Cannula. This is half ml. She has a lot of smoker lines. They are quite deep, okay? So she will need multiple treatments. Not from the first time you see a big difference, because it's very, very, very deep. Okay? Sit up. Little bit of difference, little bit of lifting. But I had to show, every single type of patients that you can get in the clinic.
This collagen?
This is collagen plus, C+. Yes, and I used with it the medium as well. So I need the collagen C plus. Okay. Très bien. Again, the entry point, please. Can you sit up? Smile. Relax. Okay. So, what would you do for a patient that comes to you and she has a lot of wrinkles? Would you do for her fillers? Would you do for her threads? Would you send her for surgery? Hmm? Yes. So I'm going to do the direct injection technique in the lines themselves. So we used M with cannula, then we used M, direct injection, and we used the collagen C+. I only did the upper lip. We will continue later with the other treatments. Can you sit up? It's not bad. No. It's not bad at all, right? But you will need multiple treatments, okay? I wanted to show you with really damaged skin what you can do. If we're using meso, if we're using fillers, it's a different case scenario. So this is a patient where I only used meso. Now I need to do a full face. Sleep back, please. Yeah. You okay? For her, we will inject the nasolabial folds. And the marionette. Can I have the other one, please? Lateral jawline. Again, under eyes. Oh, another needle. This is broken. Can I have yellow head?
This one's okay?
Yeah, that's the one. Thank you. So our recap, we did a mixture of Aqua Booster, DNA, and NHA, okay? We did the 5-point injection, and now I'm doing the full face approach. One more thing that you can do for this patient. She comes to you and she tells you, I have an event. It's the wedding of my daughter, and I want to look really good. What would you do for her? Yes. What would you do for her? You do for her amber, okay? So this is the amber. We use the 1 ml syringe. I need 18 gauge. And I need the green head needle, please. Succinic acid is going to give her an instant lift. 1, 2, 3. So just trying to show you without fillers, if you just want to do meso for a patient, for a quick fix, you're okay? Yeah? Good? Okay. Happy? What, pain? No. Okay. Good? Okay, I need the cream, please. Cream. Yes. And she's done. I'm gonna let her sit up and you will see. A patient like that, I would tell her to come to me every week for meso. Okay? What did we use? We used a combination of aqua booster with DNA with NHA. Okay? 2 ml, 2 ml, 2 ml. This is a total of 6 ml. Then I injected them at the 5 points, then I injected them superficially. Right? I finished off with 1 ml of amber. Amber, always use it with a 32 gauge needle. Now sit up, please. No. Okay. And no. No. Stay like this. Okay. What do you think? Okay? It's good. It's not bad. Thank you. Merci. Thank you. We continue later. Yeah. You know what? I think I will continue your face by the time there is or we can put for you numbing cream for the lips. You don't need it?
No, I don't have the cream. No.
I will put for you.
Okay. Now?
No?
Do you want me to see?
I take care of my skin from very young age.
It's very nice. Very nice skin. So we just need to put the cream. This is our last candidate. If there's anything you want to ask me, go ahead. If there's anything you want to see, let me and we can find a victim for that to work on. Cream. No, the numbing cream. I think there's no need for the numbing cream. We'll just put anesthesia.
I can take it.
Okay. Give me. This is what.
This one or no?
I would adrenaline. Very good. Okay. This is the one used at the dentist. Okay. Do you have any allergies?
No.
Allergy to adrenaline?
No.
Have you been to the dentist? You had injections? Everything went fine, yeah? Oh, okay. So, let me use this one.
And which needle?
Yellow. This one, look how I fill it up like this. Okay. Again, another one, please. Put the yellow.
What's your opinion on my skin? Do you think I need the full face?
Okay, guys, you tell me, what does she need? Mainly. What would you do for her? Let's say theoretically I want to do the full face. What would I use from the products of Infini? Let's start with the fillers. So if you use combination of L and XL, XL to do the contour like we were doing with the cannula, and the L direct injection so that she gets the beautiful lift. For the jawline also, once you use the cannula, you use the XL. If you want to give her a bulging, you're going to give her the L direct injection. For the chin, she needs at least 3 to 4 ml of filler direct injection L, or also you can use the cannula. Don't do them all together because you will have like a lot of pain and pressure. So it's multiple sessions. Let's start with the anesthesia. Can you clean, please? Everything? Yeah. Spray. For this, I have to take her a little bit backwards. So you need to fix the camera, I think. Can you clean, please? Yeah. No, only here. We're doing the lips. Are you comfortable?
Yeah.
And this one. Now I have a special technique for injecting the lips, but this is in other courses. special for the lips. So I will just do the regular one. Okay? 1. Are you ready? 1, 2, and 3. Bravo. Excellent. 1, 2, 3. Excellent. 1, 2, 3. You're good. Did you feel that? Bravo. And you're done. Thank you. Whenever you're ready, I'm ready. Meanwhile, anybody has any questions? You enjoyed the conference? Yeah? If you guys come to Dubai, let me know. I would love to see you again. Really. You have my Instagram. Just text me. Numb?
In this area, in this not as much.
Let me have more. Oh, sorry. Can I have a face mask, please? Down. Numb. Good. Oh, I cannot put a face mask. Forget it. I forgot. So we're going to use the Infini M direct injection. You can get me one from there. M direct injection. I hope you don't bruise. Alrighty. Can you come up as much as you can? You feel nothing, huh? No, come up. The entire body, like
Okay.
this. Sit up. No, sit up.
Oh, sorry. You want me to sit how?
Sit, yeah, so your head here. Come closer to me here. Okay, thank you. Let's start. Yeah, this is good. It's fine. Just because when I do the lips, I let the patient sleep back all the way and I do it while sitting on a chair. But it's fine. All righty. Let's start. Ready? I will start with the lower lip because it's less painful. I need, please,